So today's learning session is titled Personal Health Literacy. So I want you to, when you going into this learning session, come at it with a couple hats on. So thinking about it as yourself as a patient, kind of as, when you're going to any healthcare appointment as yourself, just being a patient, and kind of how you would just thinking through how you go in and how you would prepare yourself, and just going into that with your own personal health literacy in mind. So think about this as kind of your healthcare journey and preparing yourself and going through these steps. And then also at an organizational level. So whether, I know that everyone here comes from different sectors. So and so you might have patients, you might have clients. So think about this also as how you can prepare and best help your clients or your patients. So as you're helping them to improve their personal health literacy, how can you best help them in these ways? There'll be different tips in here that you could help them in their journey, in their healthcare journey. So kind of think about this with those two different hats on as we're going through this. And so so that's why I've labeled this kind of empowering your healthcare journey. This can be thought about in those two different ways. So today, my hope is that you will learn how to prepare for medical appointments to improve communication with your provider, that you will feel empowered to be involved in your healthcare decisions, and that you will learn how to use teach-back method with your provider to check your understanding of information. So we will start by discussing how to prepare for your medical appointments effectively. So preparing for medical appointments is vital to being part of the decision-making process with your healthcare team. So when preparing for an appointment, you should make a list of questions that you want to discuss with your healthcare team. You want to bring a list of important health information. You want to be prepared to explain your symptoms clearly, and be prepared to take notes and understand the next steps before you leave appointment. And so we're going to talk in depth about each of these 5 things. So before each appointment, think about what you want out of meeting with your care team. What concerns do you have? What decisions do you want to make at the appointment that you're going to? What might your doctor ask you? So write a list of the questions down so that you don't forget anything. And we know that we all have appointments for different things. So a question that you might write down is, what are my treatment options? And that would be followed up with, how soon do I need to choose a treatment? And what are the side effects? You would want to write all these things down so that you don't forget anything when you're going in. Another question that you might write down is, if you're going in for, follow-ups to a test, or you're going in to get a test on a specific diagnosis, just, do I need a test to confirm my diagnosis? And follow-up questions to that you probably want to ask is, where do I get the test? How is the test done? What does the test tell you or us, so that you can be informed by that? So writing all those things down. Another appointment that you might go in for is for a medication. So just asking, what is the medication for? What are the side effects to that medication? When should I take this medication? Should I be taking it with food? Some of those side effects again. So writing all those down. Another question that you could write is, how long will my recovery be? This would, of course, be like a pre-op appointment? And then what help will I need at home? Something that a lot of people may not think about asking, but how long is this going to be and what help? So just thinking through different appointments and what you want out of that appointment, and write down all of these questions, because a lot of times we get to our appointment and the doctor might start asking questions and different things come up and we forget what we really wanted, and then we leave and think, oh, I forgot to ask this that I really needed to ask. So write all of those down and the possible questions that you may have so that you don't forget to ask any questions. The next thing is to bring your important health information. So have a notebook, have an app, have a note section on your phone, whatever works for you. Everyone's different in what works for them. So whatever works for you. But something where you're going to put down all of this information, everything's on the screen. I know there's a lot written on here, but I wanted to have it up so you could see it. But somewhere where you can keep kind of a health journal that you will keep all this information, and you can quickly get to this information so that when someone from your healthcare team asks this, you can quickly get to it. You don't waste time trying to think through it, and you can always be accurate and consistent. And you'll always keep this information up to date as things change. So you have a historical log. And as we know, we can sometimes forget past medications, forget past symptoms, and this will help with that quick recall. So you'll want to write down any current symptoms that you're having and be really accurate and in depth about those. Write down any past symptoms that you've had and dates that you experienced them. Write down any current medications that you're on and past medications, and any adverse reactions that you've ever had to a medication, and if you stopped taking medication, why you stopped taking that medication. Keep a track of any allergies that you have. Keep track of any diagnoses that you've had, when you had those diagnoses also. Write down any past procedures that you've had, surgeries, including the dates of those, and who your provider was that did those would be a really good thing, and where it was done. The results from any lab work, imaging, medical tests, etc. Write all that down and keep that in your journal. Write down and keep a log of the names, phone numbers, addresses of all your providers, and names, phone numbers, and relationships of your emergency contacts, and then the name, phone number, and address of your pharmacy. So these are the things that should be in this medical journal. And if you keep it up to date, then everything will be quick and easy to get to, and you don't have to continually remember it. And it becomes this journal that is quick and easy to get to. So the next thing is you want to always be able to clearly explain any pain that you're having or symptoms that you're having. This really helps your healthcare team give the best diagnoses and treat you in the best way that they can possible. So if you can give them the most clear explanation to them, they can start pinpointing maybe tests that they need to run, any other things that they need to do, pinpoint the correct medication that they may need to give you, or at-home treatments. So these are the kind of things that you'll want to share with them. And again, this is the stuff you'll write in your journal, so when you get there, you don't forget anything. So you'll want to talk about the location of this pain that you're having or a symptom that you're having. Is it in one spot? Does it go like from your elbow down through your fingers? Is it a radiating pain? Is it a symptom? Is it a rash that appeared on your hand and now it's spreading down through your forearm? Write those things down. The timing, when did this start? Did it start on a certain date? Did it start after you started a certain medication? Is it correlated with something? Did it stop or is it ongoing? And then the duration, again, how long did it last? Was it a certain, has been going on for several weeks? Did it just occur for a little bit and then it stopped? And then again, that frequency, has it been going, had been stopping for a long time? Um, Record that and make sure you can keep track of that. And that the severity on a scale of 1 to 10. So that scale, usually 1 is this, it's annoying, but I can handle it. 10, this is the worst thing I can think possible. So writing down that scale, it may over time, then you can kind of see like on this date, it was like a 3, and on this date, it's like a 5. So it's getting worse and worse and worse. So keeping that log is really important. And to give a description, is this a pain that's stabbing or throbbing? Is this a symptom that's kind of itchy? Being able to describe that, again, is really helpful. And then write down any at-home treatments that you have used so that your provider can know, okay, this is what they've already tried. And if they were to prescribe you something, they want to make sure that they don't prescribe you something that would be that would not work with something they're going to prescribe you. So make sure that you're recording all of that. And then take pictures of anything. Again, if it's a rash, that they can see what that rash looks like. If it is a bruise, anything like that, anything that you can write, if it's a swelling, anything that you can take a picture of and write the date of it down, document pictures. That will really be helpful to them. So all of this information helps you to really communicate with your provider and share that information. So next, we talk about taking notes. So taking notes during your appointment is very important. To keep a medical journal of each appointment. This can be part of that medical journal that you're keeping, and so you want to document who did you meet with, what did you discuss, what decisions did you make, were there any changes to treatment or medications that will be happening? Are there any tests that you need to get done? What are those tests for? When will you get the results? Write down all of that information. And then this helps you make sure that you're clearly understanding what the provider says, and we'll be able to share that information back with ensuring there's clear communication. And then when you leave, you can check back your notes and say, oh, okay, this is what I need to do next. Here's the notes that I wrote down. Sometimes there's so much going on at an appointment, and depending how stressful it is, people will bring someone with them to help take notes, which is completely fine. If you bring a trusted friend, a loved one, and say, hey, can you help me take notes when I'm there? So I just have another person that is helping me, understand what's going on during this appointment. Another thing that you can do to take notes, but you'll need to really make sure that you communicate this with your provider, is just say, do you mind if I record our discussion today, so that I can go back and listen to it again if I need to refer back to what we talked about. So if you're ever going to record a conversation, just make sure that you let the other person know, let your provider say, I'm going to record this so that I can come back and listen to it. Do you mind if I record it? So just, being upfront that that's something that you're going to do to take notes of your session. But that's another way that people will take notes, is to do that. So the next step that we're going to talk about is understanding next steps. So before you leave any appointment, you want to find out what to do next. If your next step is a test, just confirm where and when it is, and again, why you're doing that test. Just make sure you really understand, I'm getting this test to confirm this is going to be done at this hospital, and this is why, and this is when I'll get the results back. If your next step is a follow-up to treatment, confirm what will happen at that follow-up, where it is, and then ask for, if you learn by someone writing that down for you, ask for written instructions. The next thing you can do is you can ask for a brochure. So you could ask someone or your provider and just say, hey, do you mind giving me a brochure about that? So if they say, you've got eczema or something, we're going to give this medication, say, can you give me a brochure on that so I can read up on that a little bit more? Or ask for a video? Do you have a video where I can watch and learn a little bit more about that? Or ask them for a website. Do you have a website where I can go to learn a little bit more? And then, it's a website that's going to have trusted information. So you can ask them to share with you some more information about where to go next. So here's just a resource that could be useful for some people. It may not be useful at all, but some people have found it useful. So it's a free app. It's an app you can use on your phone. There's also a website you can use, and it's from the Agency for Healthcare Research and Quality, AHRQ. And what this app does is it helps you develop a list of questions for your medical appointment. And it will kind of guide you through like what is the appointment for. It'll help you think through some of these questions that you may need to ask and help you write those down so that when you go to your appointment, it also helps you keep track of your appointments and help you keep track of the providers. And it'll also help you keep track of those symptoms and the symptoms that I talked about earlier, clearly talking about those. It'll help you keep track of those. So this could be a good resource for some people and to try out and see if it's useful for them. So something that you may be interested in looking at. So this is another resource that some people have found useful. It's an app from MediSafe, and it allows you to manage your medications. It gives you reminders of when to take each medication that you enter. So you put in what medications you're on, and it'll send you a reminder it's time to take your medication. It sees if the medications that you are taking could have interactions with one another. It gives you refill and appointment reminders. It has the ability to measure things like blood pressure, weight, A1C, cholesterol. It also has a diary to keep notes. This could be a place where you keep notes and things like that. It does have a paid feature on this one, but you can just decline it and use the free parts of this app. So again, just a resource that some people have found useful. If this is something that you wanted to check out and look at or share with clients, just something to look at. So now let's talk about being proactive in your healthcare decision-making process. So AHRQ that I just talked about, they gives these 10 questions that you should know. These 10 questions are things that you should be able to answer when you come home and answer these questions for a loved one who asks you, if they ask you this question. So before you leave an appointment, make sure that you know the answer to this question. So learning to be inquisitive about your healthcare empowers you in your decision making. So if you're at your appointment and you need to get a test, that's when you would ask, what is this test for? So that when you get home, if your partner, if your friend said, what's the test for? You would be able to tell them, this test is for blah, blah, blah. When will I get the results? You can tell someone else that. How do you spell the name of that drug? Make sure you could write that down and you could tell someone else so you could look it up more if you wanted to. Are there any side effects? Will this medicine interact with medicines that I'm already taking? Why do I need this treatment? Instead of just, having your provider be the decision maker, then you asking, why do I need this treatment? And are there any alternatives? So talking that through, this is part of your decision-making process. And again, these are just 10 questions to kind of get you starting to think about being inquisitive and asking these type of questions so that you're part of that decision making. Sometimes we get very overwhelmed in an appointment and we just listen to the provider. And when we leave, then we start thinking about questions. So it's imperative to prepare ahead of time and think through these types of questions. And just think, when I leave and someone else asks me, could I answer these? And then you don't leave thinking, I'm just being acted upon. I'm not, this decision maker. So we also live in an age that we can be empowered to find out more information from home by searching for treatments, information, medications, etc. But you want to make sure that you're getting quality information that is reliable. And when you find a website, you want to look at these things to make sure that it's information that you can trust. So these are some questions to ask before trusting a website. Look at the website and say, what is the purpose of this website? Is it to sell me something? Is it to educate me on something? If it's to sell me on something, is it going to just promote that product, or is it going to give me reliable information, about a variety of things? Who wrote the information? Was this information written by the government? Was it information written by the person who's trying to sell me something? So is it going to be reliable? When was the information updated? At the very bottom of a page, it should tell you when it was last updated. If it was last updated in 2002, it may not be very reliable. Is my privacy protected? So if there, you can look and see, it's required that it says, that cookies thing that pops up, you can decline so that it's not tracking you. Also, making sure it's in HTTPS, looking at those kind of things. And are they asking you for information when you're looking at a website? Are they asking for your email address? Are they asking you for other personal information? You shouldn't have to put in personal information into a website just to get information. And does the site ask for personal information? Like I just said, you shouldn't have to put that in there. And does the site offer unrealistic health solutions? If it seems too good to be true, it probably is. So think about those things so that you can think through, do I trust this website? So think through, empower yourself by asking questions and seeking clarity during your healthcare journey. So we just discussed the importance of asking questions. So now let's talk about seeking clarity. So we're going to talk about check understanding. I'm going to talk about methods that providers should use with you, but if they don't, then you can use it with them to ensure understanding of information and that there is clear communication. So using the teach back method is asking the provider for clearer information so that you can teach them back the information in your own words to ensure that you understand what they have told you. So if you don't share back, and if you don't share back the information as they intended to tell you, they know that they did not explain it clearly and they need to re-explain it differently. If you learn better with visuals, then you can ask them to use a model, point you to a video, give you a brochure or a website where you can further do the reading. So if you don't understand, you can ask for information by saying something like, this is new to me. Will you please explain that to me one more time? Or here's what I heard you say. Do I have this right? I need to be able to explain this to my spouse when I get home. Can you go over that again to be sure it's clear for me? I want to go over this again with you because it's complicated. Can you write that down? And then you'll restate the information in your own words. So you don't want to just spit it back to them, but writing it in your own words. So a lot of us know about teach back from the provider, but if the provider doesn't do that, we can, again, empower ourselves to do our own teach back to them and ask for that. This is new to me. So this is us using teach back with our provider so that we ensure that we have that information and we understand it clearly. So empowered patients ask questions boldly and ensure that they have clear communication with their care team. So preparing for your health appointments is one of the most important things that you can do to be health literate and to take charge of your health. If you're prepared, You have thought through what you want out of your appointment, and you'll be more prepared to make decisions. So being prepared leads to better health outcomes and informed decisions. So as a summary, preparing for medical appointments means knowing your questions and health goals of each appointment. Making healthcare decisions together means collaborating with your provider by gathering reliable information so that you can ask questions for informed decisions. And using teachback will ensure that you have clear communication with your care team.